Dr. Van Kirk, it's a pleasure to be with you again here on the Medical Explorer.
Thank you. Welcome to Sutter Buttes Imaging.
It's really a fantastic facility. You know, I remember back around 1986, 87, I built my office a half a block down the street, and I thought it was always going to be the nicest building around, but your group here at Sutter Buttes Imaging and Bi-County Radiology have really outdone me. This is a fantastic project, and I'm really looking forward to showing our viewers of this area and down in Stockton as well what you've done here.
Okay. We're ready to go.
I guess my first question is, tell me what you have here in this beautiful building.
We have about 8,500 square feet here. At the present time, we have our high-strength magnet, and we have 2 mammography rooms in our business office.
Our viewers on previous shows have seen you with this type of machine. I know the one you have here is much more efficient and more powerful when you had that truck across the street in the parking lot with the MR scanner. But I'm not sure they remember the differences between CAT scans and MR scans. We know that the CAT scan uses X-rays, uses computers to take these images and put them into a very detailed picture. The CAT scan, you know, also not being invasive, not using needles very often, no cutting. What's the difference between a CAT scan, which uses X-rays, and an MR scan? What is the MR scan doing?
The physics are fairly complex, but basically the magnetic resonance imager uses magnetic waves and also radio frequency signals. The actual image is produced by a radio signal.
You can actually see, though, not just bones, you can look at other things in the body, too?
The magnet is exquisite at showing soft tissues in the body, much more so than the CAT scanner. The CAT scanner will actually show bony structures a little better.
You say soft tissues, that could mean muscles, or what other things are soft tissue?
Well, the soft tissues within the brain and the soft tissues within the joints and muscles, yes.
So you actually get more definition looking at brain tissue. You can see more of that structure. And what if I came in and I was a football player and injured my knee, and my doctor thought I had a ligament injury and said, well, the only way we can find out about that is to open up your knee and look. And we said, but well, I heard that the MR scan can look at soft tissues. Can you do things with knees?
Knee is one of our more common procedures, in fact, and we can see meniscal tears and ligament tears and fluid within the joint space, and we can even see a fair amount of detail of the bone itself.
Does the patient feel any discomfort when they're in the machine?
No, the patient just lays there and you don't notice or feel anything.
How long is an average test when the patient's in?
I would say about half hour to 45 minutes.
And if someone feels that they wanted to have this very detailed test, could they ask their doctor about that, and they would be the ones that the doctor would order the test?
Right. We only do studies that are referred to us by other doctors.
So examples, tell me some of the complaints that patients may complain to their doctor about. Would perhaps headaches as a problem, or sinus problems, or neck problems, all these things possibly be evaluated this way?
Yes, the most common usage for our magnet is head studies for a variety of problems. Headaches would be one of them. Spine studies, cervical spine, lumbar spine, primarily to rule out disc disease, disc hernias. Many of the joints of the bodies, we mentioned the knees, also the hips and the shoulders.
If someone were to be having all kinds of back trouble and they'd been to their doctor and there was a concern about osteoporosis where the bone is losing its minerals, would that show up on this test?
No, it's not used for that at the present time.
I see. But if they thought they may have broken their back, would that show up? Or would a broken vertebrae show up on this?
A broken vertebra would show up on this. It would also show up fairly easily on X-ray or CAT scan.
Okay, so there are a lot of tests that overlap, I see.
Yes.
Well, what I heard you had set up today, in fact, I sent my wife over because I wanted her to be checked out for these sinus headaches she was having. So you have a technician, and we're going to bring my wife Judy in, and you're going to actually do an MR scan on her today.
Right.
Who do you have to show us the machine today?
Our main head technologist is Dennis Lord.
Dennis, thank you for being on the Medical Explorer today. Come on over here, and we'll sort of get set up. And Judy, why don't you come in and stand next to him? You had complained about a headache for quite a while. I think you were saying it was front of your head and going around to the back of your head.
That's correct.
And we decided, I guess I decided, I didn't want to expose you to any x-rays. I just decided it would be best to do a test that was non-invasive, painless, and no danger. So I wanted you to come over here and get this MR scan. What I would like our viewers to see, though, is what an average patient would go through before they go in for the test. So could you discuss with her what you have to usually do?
Certainly. Judy, basically, a few questions. I would just want to make sure that you don't have a pacemaker.
I don't.
Good. The pacemakers can be affected by the magnetic field. The radio frequency waves can reprogram the rate that it pulses. Also, have you had any brain surgery?
None.
Okay. Inner ear surgery?
No.
And no heart surgery of any type, right?
That's correct.
Okay, it looks like it's safe to do the scan with no problems. Basically, we want to make sure that you have all credit cards and things in the locker, because the magnet can erase your credit cards and stop your wristwatch. All metal removed from that's especially loose in pockets, and then we can go inside and do the scan. Basically, we're going to ask you to lie very still for about 45 minutes. We're going to be doing the test in 10 and 12-minute increments. There'll be a chance to reach up and scratch your nose or whatever during the scan. In between the different segments. It makes kind of a loud tapping noise, but there's no discomfort. We'll have a set of headphones with music on it that will help alleviate some of the tapping sound, and we can also communicate with you through the earphones. So
Now,
questions?
What would happen if she had her purse and credit cards with her and went in that room? Would they just immediately be wiped out?
Yes, as soon as you get past that door, maybe a foot or so, what it does is erases a magnetic strip on the back of the credit card, and it's no longer has the coded numbers.
So if you should go into a store and they'd run it through the machine, there'd just be nothing there.
Correct. It would not register anything.
What if she had a lot of jewelry on that was, had metals that were exposed? What would that do?
It can actually pull on it. For example, earrings. I've had patients go in with earrings before, and it tugged their ear like this. And it's something loose and that's fairly large. For example, like a pocket knife can actually come out of your pocket and go into the magnet.
I remember we did a demonstration when we were with Dr. Van Kirk last time. We had this chain, a dog leash chain, and we held it up and it raised it right off the ground into the magnetic field. It was fascinating.
That's right. It's a very powerful magnetic field. It can actually pick up an oxygen bottle if we got it close to the magnet and fling it through the air into the center of the magnetic field. So we have to be very careful, especially ferromagnetic objects of any weight.
So when you have that warning sign on the door, that's a serious thing.
Yes, the patients are interviewed and checked about 3 stages coming in here, so that if they slips past one, it'll get it on the next person that talks to them.
We can't even bring these cameras in that room because it would wipe out the electronics and magnetic systems in that as well, wouldn't
That's
it?
right, and as well as the tripods could be affected and actually pulled into the magnet. The shutter-type cameras can, as I understand it, you can open the shutter to take an exposure and it'll lock open. And they have to be degaussed after that. So.
Okay. Judy, do you have any questions before the test?
No, but should I take off these earrings?
I think it's a good idea.
Probably would be good.
Well, let's go in and take a look how it all works out.
Okay, great. We'll have you lie here, put your hand in the holder right here. Scoot up maybe an inch or so. Get you covered up with a blanket about halfway through the scan. The air conditioner traditionally comes on just to keep you on your toes. Go up here. It's important that you remember not to move. It's a good place to take a nap. You're hearing a lot of tapping noises. I have some music you can listen to that will help with that. Straight. I have a band of Velcro across here in case you do go to sleep. And our earphones here. I'll get some music started in just a moment when I get back outside. Okay, just relax, keep your eyes closed. I'm going to turn on the bright light. It helps me position here. Good. Okay, looks like you're nice and straight. Try not to move. You'll be hearing some tapping noises starting in just a moment. Great. all there is to it.
Dr. Van Kirk, Judy's now been in there having the scan done for the past 12 and a half minutes or so, and I see there's some images coming here on the TV screen. Before we get into what we're looking at, what is this room that we're in right now?
This is our control room where we set up the studies and do the filming where the technologists work.
Now, this room is totally shielded from the magnetic energy in the room next door?
Yes, we have a window there that has copper in it to contain the radio frequency signals, and we also have magnetic shielding.
So all of the computer equipment isn't affected by what's going on in the room next door?
That's correct.
Well, you have technicians down here doing different controlling devices. What are they actually doing with the different keyboards here?
As you can see, we have two monitors and two keyboards. The one on the left-hand side that Dennis is working is used to set up the study and to determine the acquisition parameters. The one on the right-hand side shows the films that we've acquired and is used to produce the hard copy films on X-ray type film.
So when you say acquisition parameters, does that mean the energy he's going to use for the test and that sort of thing? I don't really understand.
Well, for our typical head study, we use three different sequences. Our standard protocol is we look at the patient from three different directions, which the CAT scan cannot do. It can only see from one direction. And there are many other parameters we set up with one type of acquisition. The fluid in the brain shows up black, for instance, and on the other type of acquisition, the fluid shows up white.
So basically, he's telling the machine what to look for, what to look at, and
right.
what comes up is in the next unit, what we're actually seeing.
That's
Now,
right.
we're looking at an image now of the sort of a cross-section through the middle of the brain from the side. Can you point out some things like where is the main thinking part of the brain? Where would the cerebrum be in there? Could you show that, maybe point that out to us?
Okay, as we mentioned, we can image from three different projections. Here we're looking at from the side of the head. We call that sagittal slices, and in the front is where the most of the thinking is done in the brain, the anterior part of the cerebrum.
Now, everybody's heard about the cerebellum, which is controlling balance. Would that show up here too?
Yes, on this midline slice we see the cerebellum very nicely in the posterior part of the head, and we also see the brainstem and the spinal nerves going down into the spinal canal.
So when you point it to that brainstem, that's the area that controls the involuntary respiration and the heart of the body, and that's what people hear about when people are in comas, that's what's controlling the life functioning of the body.
Right.
How about sinuses? Do those show up at all?
Sinuses show up very nicely on the MRI scan. We see here the frontal sinuses and also the sphenoid sinus. The maxillary sinuses, which are probably the sinuses that are most commonly diseased, will show up better a little later on our axial planes, looking from a different direction.
In this image, we see the sinus looks like just clear airspace, and that would mean in most cases it's pretty normal.
That's what we should have, yes.
And if there was an infection or something like that, what would you see instead?
If there was an infection or fluid of any sort, then it would show up as a white area on some of our sequences.
So can we say so far what you've seen that Judy looks pretty healthy?
So far, everything looks good.
What can you do now with the computer to look at other images? Can he scan through and look deeper?
Well, we can scan on through. In fact, right now, if John would roll through the images, we can go from one side of the head to the other. These are all two-dimensional slices through the brain, looking from the side.
Now, the white rim at the around the brain, that's not the skull. That's something else?
That's actually fat within the diploic space of the head. The bone shows up black on the magnet.
So you're actually just seeing the tissue right below the skin with sort of the fat layer in there.
We're seeing a layer of fat.
Dr. Van Kirk, I'm going to ask one of your technologists here a question about the system. We see the images come up here on the computer monitor, but what if I wanted to give these to another doctor outside your office on a piece of film? I know how that works with laser printers in an office or at home if I want to print something, but how do you print an image like this?
Well, it's almost exactly the same. What we're doing on this console here is doing the photography of the images we acquire over here. And they go on a laser, they're written onto the film by a laser camera, a laser printer. and it's hooked to an automatic processor, and they come out over there without us having to handle the films at all. We can print one copy up to 99 copies of each film as we go.
How long would it take from when you push the buttons to get the pictures on the film to actually being able to have that film in your hand to look at it?
About 2 minutes, 2.5 minutes.
That's fantastic. I remember the days when they'd have to carry the films into rooms and then go through the processing with chemicals and all of these things, and now it's just all automatic.
Yeah, it's much faster, and it saves a lot of man hours and a lot of steps.
Well, Dr. Van Kirk, what I'd like to do is go into your viewing room and actually see the many different images that you can get from this test on the actual film. Can we do that?
Sure.
Let's head over. We're now in the viewing room here at Sutter Buttes Imaging. Dr. Van Kirk, you showed us how the computer images are put on this actual photographic film, and now we're looking at the entire MR scan of the brain. Can you give us a little overview of what we're looking at?
Okay, we have at least 4 sets of images that we've acquired on your wife. The first set of images here are from taken from the top of the head on down. There's slices through the brain, and this first frame here shows the lines show the level of the slices, and then
it's incredible how many different types of views you can get as you go almost millimeter by millimeter down through the brain. That's fantastic.
Yeah, each slice is about 7 or 8 millimeters thick.
So it is, I
but
see.
we can vary that quite a bit. We see here the good distinction between the outer part of the brain and the inner part. We call that gray matter and white matter. Moving along, we see the orbits of the eyes, and we see the maxillary sinuses with air in them, which is why they show up black, as they should.
And then if there was an infection here, you'd see little fluid levels or structures like polyps or growths in there.
We could see polyps, and we can see fluid levels or just thickening of the mucosa that surrounds the...
Yeah, are these little openings in the skull the ears? Is this where the ears would be, right in here?
That's right, those are the ears.
And are you able to sometimes even see the nerves that supply the ears on these scans?
Right, and I think we can see that moving on to this other sequence over here best of all. We have a blow-up frame that shows the 8th nerves, the nerves that allow us to hear, these little white lines on either side. Now this is an entirely different sequence where the fluid in the center of the brain shows up real white.
If there was an example, a tumor or a growth pushing, you would see them sort of indenting in on those fluid areas?
We might see the fluid areas obstructed, and therefore they'd be more dilated. We might see them pushed over by the mass, and the mass itself would probably show up as a white area.
I see. Here we're looking actually at the eyes themselves. You actually see the eyeballs, the structures of the eyes here.
And the eyes show up more prominently on this type of image because we're seeing the fluid that's in the eyeballs.
When you have this information now and you're in this room, you have a tape recorder set up, you actually now are going to be dictating in the tape recorder exactly what you see on this finding, and that what happens to that? It gets typed and then sent to the physician who ordered the test?
That's right.
Would there ever be times you might want to pick up the telephone and call the doctor about it as well?
Frequently we will do that, especially if it's a problem that we perceive as fairly acute and needs acute attention.
Great. What else would go on in this room besides this? You'd be looking at all different types of MR scans and other images, and I guess we want to talk, of course, about another important thing you have going on here, which is mammography.
Right.
I've seen in the paper some different news articles about mammography that you're doing here where women can actually come into your office without having a doctor refer them if they choose to have the test done?
Right, that's something new for us, and it's called self-referral, and patients are able to call up on their own and make an appointment. We do require them to give us the name of a doctor who we can send the report to.
Right.
We feel it's important that the patients have adequate follow-up.
So if we know the American Cancer Society has certain criteria where they say women at a certain age are supposed to go in to get a baseline mammography to see that they're not having breast cancer at that point, so if something later would show up, you'd have something to compare to? Is that what you mean by a baseline test?
Right. They recommend a baseline study between age 35 and 40, and the big advantage of that would be that if a few years later, or a couple of years later, the patient detects a lump and comes in for an examination, it'll be very helpful for us to compare the previous baseline study with a new study.
So if we had, or just a woman watching the show tonight, decided she wanted to have this test done to screen for the possibility of breast cancer, what would she do? How would she get the test going? Just pick up the phone and call?
Just pick up the phone and call the Sutter Buttes Imaging.
And that's now, is that in the phone book at this time, or does it have to call directory assistance?
I'm not sure if it's there yet or not. The number is 674-9000 if you'd like an advertisement.
Great, fine. No problem. This is a public service program to get people to get checked out. So 674-9000.
Right.
And they could get you right here. I understand you've also moved the Bi-County Radiology business office to this building, which makes it more convenient for people that have questions about their bills or Medicare or whatever they're dealing with to come in and ask about it if they want to.
Right. The patients can come in, and the area we have here is much more spacious than what we had at our previous location.
I noticed that when we did a show several years ago on mammography at your other facility, you had so many things going on there at once that you expressed a concern that this building was built to provide excellent privacy for the women going through that test. Is that right?
I think that's the thing. One of the things we're most proud of with this new facility. We have a separate women's dressing area, and from that area there's a side door right into the mammography suite, and where we have 2 mammogram machines, and it's quite a private setting.
Well, I hope that we can bring the Medical Explorer cameras back out here again and actually take a look at the mammography unit. Our time's running a little short today, but it's been a fantastic demonstration. I'm sure my wife Judy will be pleased to see that her study is very normal and she doesn't have any evidence of a brain tumor, so you don't need to send me any cards. And no sinus infection or anything like that, so we're pleased to see that today. Thanks for having us out today, and it's been a pleasure, Dr. Van Kirk. Thank you.
Thank you.